Now we are talking how the systolic pressure happens. Look at this diagram, this area, left area of heart. When blood enter action potential, after action potential, blood arrives into the aorta. Before the aorta, one valve known as semilunar valve. From semilunar valve, when it opens, like this, open. When it opens, you will see a sound known as lub, S1. After that, blood enter into the aorta. After semilunar valve now close this, the shape like this. When it close, blood enter aorta and arise into the arteries. Because semilunar valve closed and pressure increased in the aorta. This pressure around about 120 millimeter of mercury. This pressure normally known as systolic pressure. Look at this point again. We are coming how the dub sound you will see when valve, semilunar valve close, known as dub. When semilunar valve open, known as lub. Lub, dub, lub, dub, lub, dub. S2 phase, dub. Close and open. I hope you understand how the systolic mechanism. And a lot of explanation I will explain you about cardiac muscle, like how the cardiac arrhythmia, how the echocardiography, how the electrocardiography, and what's the circulation in cardiac muscles, and how the circulation in arterioles, veins, and how the percentage in the arteries, arterioles, venules, which kind of percentage,